pharmacology series. In my previous lectures, we have explored the different classifications, the different classes of antifungal drugs, the mechanism of action, therapeutic uses, and toxicity profile of various antifungal drug classes. In today's video, we will directly compare three of the most clinically important antifungal drug classes, namely Amphotericin B, Azoles, and Echinocandins comprising of caspofungin and micafungin. So let's start off with Amphotericin B, the mechanism of action of Amphotericin B. Amphotericin B acts on the cell membrane of the fungus. So it has high affinity for ergosterol, which is an important component of the cell membrane, and it causes pores. It forms pores in the membranes leading to cellular leakage and death of fungus. So it is fungicidal in nature. When it comes to azoles, they act on the ergosterol synthesis pathway by inhibiting important enzymes, that is 14-alpha-sterol demethylase. So by inhibiting 14-alpha-sterol demethyl, ergosterol synthesis is inhibited. Remember, there is another enzyme that is responsible for the synthesis of ergosterol, and the name of the enzyme is squalene epoxidase. So squalene epoxidase is also involved in the synthesis of ergosterol, and this enzyme is inhibited by allylamines, and the drug is terbinafine. So allylamine is an important class which includes terbinafine, which acts on squalene epoxidase, inhibiting the ergosterol synthesis. So these drugs act on the ergosterol synthesis pathway. Now coming to echinocandins, they inhibit beta-glucan synthesis and inhibits the cell wall. So they inhibit the cell wall synthesis, and therefore they are also fungicidal in nature. It is only azoles which are fungistatic in nature, whereas Amphotericin B and echinocandins are fungicidal in nature. Now let's discuss the routes of drug administration. So can Amphotericin be given orally? The answer is no. Amphotericin B is not given orally. It is given parenterally. It is given intravenously for treating invasive and serious fungal infections. So systemic mycosis such as histoplasmosis, blastomycosis, candidiasis is best treated with Amphotericin B. It is also given intrathecally to treat cryptococcal meningitis. So cryptococcal meningitis can be treated by intrathecal administration of Amphotericin B. Now coming to azole group of drugs, they are classified into imidazoles and triazoles. The imidazole class includes ketoconazole, which is available as oral and topical formulations. And then we have topical formulations such as clotrimazole, iconazole, miconazole, and sertaconazole. So the topical formulations are used for treating superficial fungal infections, and clotrimazole is available as vaginal pessary or vaginal suppository and is commonly used for treating vulvovaginal candidiasis. So vulvovaginal candidiasis can be treated with topical formulation of clotrimazole. Now sertaconazole has antipruritic and anti-inflammatory property, unlike other azole group of drugs. So sertaconazole is best suited for dermatological lesions which are associated with pruritus and inflammation. So sertaconazole has anti-inflammatory property, antipruritic property, and has dermatological uses for treating superficial fungal infections that are associated with pruritus. Now coming to triazole class, which includes fluconazole, which is given orally and intravenously, itraconazole, which only has intravenous formulations. So fluconazole both oral and intravenous, itraconazole only intravenous formulation, voriconazole is available as oral and intravenous, posaconazole is available as oral intravenous. So itraconazole is an exception in the triazole group of antifungal drugs, where the formulation that is available is only parenteral formulation is available. So no oral formulation, whereas fluconazole, posaconazole is also available as oral form and can be used for treating non-serious fungal infections. Speaking about echinocandins, which includes caspofungin and micafungin, are given intravenously for treating serious fungal infections that are resistant to other classes of antifungal drugs. So systemic mycosis such as candidiasis, aspergillosis can be treated with the echinocandin class of drugs, that is caspofungin and micafungin. Now speaking about echinocandins, that includes caspofungin and micafungin, are given intravenously for treating systemic fungal infections such as candidiasis, aspergillosis, the infections that are resistant to other antifungal drugs. Now, to be kept in mind that there is another new drug, that is ibrexafungerp. So, ibrexafungerp is a novel drug that is approved by FDA for treating vulvovaginal candidiasis. So, vulvovaginal candidiasis can be treated by a new drug, that is ibrexafungerp, which is available in oral form. Now, these drugs act by inhibiting the synthesis of beta-glucan. So, beta-glucan synthesis is inhibited, and this inhibits the cell wall of the fungus, leading to death of the fungus, and they are fungicidal in nature. Now, let's discuss the therapeutic uses of different antifungal drugs. Now, talking about Amphotericin B, it is best suited for treating invasive fungal infections, so serious fungal infections or systemic mycosis such as histoplasmosis, blastomycosis, coccidioidomycosis can be treated with Amphotericin B. It is the best drug for treating systemic mycosis. Also, yeast-like fungi such as Candida, disseminated candidiasis, cryptococcal meningitis can be treated with Amphotericin B. It also treats opportunistic fungal infections such as aspergillosis. So these are some of the therapeutic uses of Amphotericin B. Now talking about azole group of drugs, as we have discussed, they are divided into imidazoles, triazoles. Imidazoles includes ketoconazole, which is available as oral and topical formulations, and then topical formulations such as clotrimazole, iconazole, miconazole, cetaconazole. Ketoconazole or oral ketoconazole can also be used for treating systemic fungal infections. However, it has certain adverse effects such as hepatotoxicity, drug-drug interaction, decreased absorption. It requires acidic pH for absorption, decreasing its bioavailability, and it also can cause gynecomastia. So, itraconazole has replaced ketoconazole and is preferred for treating systemic fungal infections. So, in case of a serious systemic fungal infection, treatment is initiated with Amphotericin B and later switched to itraconazole, which is available as parenteral formulation, and it is used as maintenance therapy. So, serious infection, Amphotericin B is the drug of choice, can be switched to itraconazole, and it can be used as maintenance therapy. So, what about the role of fluconazole? Fluconazole is available as oral and intravenous formulation. Oral fluconazole can be used for treating non-serious fungal infection such as esophageal and pharyngeal candidiasis. So, non-serious fungal infection, oral fluconazole is commonly used. Now, what is the role of voriconazole? Voriconazole is the drug of choice for treating aspergillus infection. So, invasive aspergillosis, the drug of choice is voriconazole. What is the use of posaconazole? Posaconazole is a broad spectrum antifungal agent. It is used for prophylaxis. It prevents invasive fungal infection in immunocompromised patients such as HIV. It is also used for treating infections that are resistant to the other azole group of drugs and echinocandins. So patients who are refractory to treatment with other antifungal agents can be treated with posaconazole. Topical preparations, as we have all discussed, clotrimazole is available as vaginal pessary, used for treating vulvovaginal candidiasis, and cetoconazole has anti-pruritic and anti-inflammatory property and it is preferred for treating skin infections that are associated with pruritus and inflammation. So it has got dermatological uses. Now talking about echinocandins, which includes caspofungin and micafungin, are given intravenously for treating candidiasis and aspergillosis. There is an oral form of drug which acts by inhibiting beta-glucan synthase, and it is FDA approved for treating vulvovaginal candidiasis. So the name of the drug is ibrexafungerp. So ibrexafungerp is a new drug and it acts by inhibiting beta-glucan synthase. It is FDA approved for treating vulvovaginal candidiasis. So vulvovaginal candidiasis can be treated by a new drug, that is ibrexafungerp. Now coming to the adverse effects of antifungal drugs. So which is the most toxic side effect of amphotericin B? Nephrotoxicity is the concerning side effect of amphotericin B. It is associated with azotemia, rise in blood urea nitrogen and creatinine. So nephrotoxicity, an important side effect of amphotericin B. Infusion reactions are also common with amphotericin B because of release of cytokines such as interleukin 1 and tumor necrosis factor alpha, causing reactions such as fever, chill and rigor and hypotension, also leading to shock. The third important effect is electrolyte abnormalities can occur. It can cause hypokalemia, hypomagnesemia. Therefore, monitoring of electrolyte levels is necessary with amphotericin B usage. It can also cause anemia due to decreased erythropoietin secretion, due to decreased erythropoietin synthesis, leading to anemia. Thrombophlebitis is also a side effect of amphotericin B, leading to inflammation of the veins. So amphotericin B is highly potent and efficacious drug for treating systemic fungal infections. However, it has certain limitations. The toxicities are limitations of amphotericin B. So how do we overcome the drawbacks of amphotericin B? By giving liposomal formulations of amphotericin B. So liposomal formulations of amphotericin B decreases the side effects of amphotericin B, decreases the toxicities. Also for treating cryptococcal meningitis, amphotericin B can be combined with flucytosine for synergistic action. Remember, flucytosine is a DNA synthesis inhibitor, decreases the multiplication of fungus. So when given in combination with amphotericin B, the dose of amphotericin B can be reduced, and this decreases the toxicity, this decreases the side effects associated with amphotericin B. Coming to the toxicities of azoles, all azoles are eliminated by the liver, they are metabolized by the liver and are not dependent on the kidney for excretion. Therefore, they are renal safe with the exception of fluconazole. So, fluconazole is the only azole. It is an exception. It is excreted through the kidney. Therefore, fluconazole is not preferred in kidney disease. All other azoles are renal safe. So, fluconazole is not used in kidney disease. Oral ketoconazole, which can be used for treating systemic fungal infections, is also associated with side effects such as hepatotoxicity, drug-drug interaction, gynecomastia, decreased bioavailability. So, oral ketoconazole has been replaced by itraconazole, which is given intravenously. Now, to be kept in mind that itraconazole is renal safe, it is not excreted through the kidney, it is not dependent on the kidney. So, dose adjustment is generally not needed when itraconazole is given intravenously, but do remember that the intravenous formulations of itraconazole contains cyclodextrin. So, cyclodextrin is nephrotoxic. Therefore, caution is advised with intravenous use of itraconazole and also voriconazole because of the presence of cyclodextrin, which is nephrotoxic. Now, when it comes to echinocandins, echinocandins are also eliminated and metabolized by the liver, so they are not dependent on the kidney for excretion, so they are renal safe. So, echinocandins are also renal safe and can be prescribed in a patient with kidney disease. However, hepatotoxicity is the side effect of echinocandins. So, in this video, we have compared the mechanism of action, the routes of drug administration, how to select an appropriate antifungal agent depending upon the clinical condition, the toxicities, and how to overcome the toxicities of each class of drugs. So, thank you for watching. If you find this video useful, please like, share and subscribe to this channel.